All right. Hello, everyone. Thank you for joining tonight's webinar with Pennsylvania Residency Program Directors. I have 4 directors and an assistant director with me here tonight to speak with you and answer all questions that you have. I encourage you to unmute your microphone or type any questions into the chat when we get to the question and answer. If you have any questions during introductions, you can also type them in the chat and I will read them after. And the directors joining us tonight are Dr. John Schrenker from Allegheny General Hospital, Dr. Michelle Pisano-Marsh from Lehigh Valley Network, and her assistant, Dr. Aman Boss. And then we have Dr. Mehran Hassani from Temple Oral Maxillofacial Surgery, and then Dr. Elizabeth Palowitz from the University of Pittsburgh Medical Center.
Okay. Very good. Would you like me to start off then, Amanda?
Absolutely. Go ahead.
Okay. Very good. I'm Dr. John Schrenker. I'm the program director at Allegheny General Hospital, which is a level 1 trauma hospital in the city of Pittsburgh. And we have 4 residents each year in our general practice residency, and we're definitely a hospital-based program. Each year, we probably get somewhere in the neighborhood of between 25 to 35 applications. And as I said, we have 4 residents each year. So when to apply, generally early in the year. We are currently a match program, and the applications are due usually sometime in October. Our deadline was October 1st this year, and we can begin interviewing candidates shortly after that. Our interviewing this year is November the 10th is when we're going to start that. And then we have to have all of our rankings and whatnot in by, we can begin submitting them in December 11th. And then the deadline is, I believe, January 12th. Once the rankings are submitted, and if you're a candidate that's interested, you need to be registered with the match, and you need to go through the ADEA class system to submit your application to us. I review each and every application that comes in, and then I make some notes on that, and then I pass that along to the other 4 full-time faculty members. And then the 4 of us will conduct the interviews in early November. This year, the match has moved up their match date notification to mid to late January. So you would be hearing from them, I think January 22nd is the date this year. And then we will start the ball rolling by getting you in touch with our HR department to begin the onboarding process. And that can take a little bit of time because in Pennsylvania, there's a lot of regulations that we have to meet so that you qualify to come into our facility and be able to become a resident and treat patients. So if you are thinking about applying, I would say get your applications together in probably late summer and get them submitted no later than September. The deadline is October 1st. That gives us some time to review them because there's a lot of information in there that we like to go over and weigh. One of the other items that I was asked to mention is, what is our stipend? Allegheny Health Network has a first-year postgraduate stipend. It's a salary. There are also some other benefits that go along with it. You can pick and choose your benefits. We have health benefits. There's parking. There is a voucher that you can use monthly in our cafeteria for meals, breakfast, lunch, dinner in the cafeteria during your work day. And typically, what's our day-to-day work like, or look like, I should say. We basically are in the clinical area from 8 a.m. to 4 p.m. in the dental clinic. We take an hour break for lunch. It's basically like it's a dental clinic. So we see patients of all walks of life. We have literally homeless people to executives in the Allegheny Health Network. We have private patients, we have insurance patients, and we have patients that are on some form of government assistance. And we also deal a lot with a lot of special needs patients. We have a strong working relationship with the Positive Health Clinic in the city of Pittsburgh, which directs patients who are HIV positive to our clinic. And we have a terrific working relationship with them. And they have grant money that's available so that we can provide whatever that patient requires to bring them up to a good level of dental health, we're able to provide for them. We see patients come in through the emergency department, and we also, whether they be trauma cases that we get called in on, we work closely with oral surgery, we work closely with plastics, we work closely with ENT, and with the emergency room docs. We have a lot of patients who are requiring clearances for oncology purposes prior to radiation or chemo. We have clearances for transplants, joints, cardiovascular, and we also, the residents do take call one week a month. And if there's something comes into the emergency department, you'll be notified, or if there's a consult on the floor that needs evaluated, you'll get to do that. We follow all the coded guidelines for accreditation, so you'll be taking rotations in multiple areas of medicine as relates to dentistry. And we've added some extra ones and we work closely in collaborating with the ENT department. So you get to work closely with the ENT surgeons on some of the patients that are undergoing surgical procedures for oral cancers. We have a really good working relationship with Catholic Charities, which is a needs, well, I shouldn't say needs, but it's a sliding fee scale. And they provide basically free healthcare to folks in the Pittsburgh region. We have you over there for 3 weeks out of your year with us. Dr. Parisi does a terrific job of helping you do maybe more crown and bridge and endos and some things that maybe the patients in our clinic may or may not be able to afford. So we try to do as much as we can to get you in the clinical setting as much as possible. And I've talked about patients we see. We are one of the few, at this point in time, we are the only facility in the Western Pennsylvania that is seeing special needs patients in the OR. Children's Hospital will see them up until age 12. And the Special Needs Clinic, unfortunately, at the University of Pittsburgh, it does a wonderful job, but unfortunately they're swamped and had to cut back on their OR time. And at this point in time, we're the only facility in Pittsburgh that is seeing special needs patients in the OR or complex medical cases in the OR. So you do get experience treating patients in the OR as well. We do outpatient sedation cases as well. What are our expectations? We're looking for people who want to stretch themselves, that want to be challenged, that aren't happy staying in a comfort zone, that want to be of service to those people in the community that are in need for dental care. You know, as dentists, we have a specific, specialized set of skills that nobody else can provide for these people in need in our communities. So we hope to not only instill with you a desire to learn more, to reach higher, but also to serve those people who really could benefit from the services that only we can provide. And we tie that in with a holistic approach. And it's the total patient. We like to step back, look at the whole patient and see what all's going on not only in their lives, but also with their health that is contributing to them having whatever level of dental disease, dental dysfunction that they're experiencing, and then coming up with a treatment plan that just doesn't address the emergent problem or the specific problem, but to help you to learn a treatment plan from a long-term goal. And the length of the program is 1 year. It's 12 months, and they're 12 very busy months. So that's a quick wrap up of what we do here at Allegheny General.
All right, I guess I'm next, and I am Dr. Michelle Pisano Marsh from Lehigh Valley Health Network, and with me I have Dr. Ammon Boss. He is the Assistant Program Director. He is the future of dentistry at Lehigh Valley Health Network, so it's good to have him here. So I'm going to just go through the bullet points, and I wrote some cheat notes for myself, so I apologize if I'm looking aside. Generally, how many people apply? I looked through the last 5 years, and we've gone from a high of 75. I think that was the initial post-COVID year when everyone was afraid they wouldn't be able to practice unless they were in a program, to 45 for our low. How many are accepted? We currently have 8 residency slots. So we bring in 8 new residents every year. We have 2 different clinical sites that we practice at, one in Allentown, Pennsylvania, one in Bethlehem, Pennsylvania. They are literally only about 15 to 20 minutes apart. It's very, very close. We call the Lehigh Valley ABE for Allentown, Bethlehem, and Easton. So those are our 3 cities that make up this valley. When to apply, I would agree with everything Dr. Schrenker said. Try to have your stuff together by the end of the summer, get everything in during September. This year, we closed applications on October 15th, and we will also be interviewing, interestingly, on November 10th and November 11th. So try to get things done as quickly as you can early in the cycle, because we do look through every application. Obviously, we have a little more time to spend with the ones that get in there earlier. So I think it's to your advantage to get things done quickly. Currently, our stipend is $67,472 exactly, because I looked it up. And there are benefits related to that. Don't laugh at me, Dr. Boss.
I'm not. It's very specific. I have it written down myself here, along with the benefits.
Good. My recommendation really strongly to you is, if you're interested in a program, to look at their website. We all have websites. So if you go to lvhn.org/education, you will see the different residency programs that are offered by Lehigh Valley Health Network. And you will see that there's a general landing page for all residents, because all residents are treated equally and have the same benefits and the same stipends. You would be considered PGY1, which is postgraduate year 1. That's what that stands for. So you can find out everything you want there, and then you can go specifically to the dental page and find out a little bit more about that program. And I think that that's always a good thing to do when you're looking into things. We are also a level 1 trauma facility. We are, for a hospital that's not in a major metropolitan area, we are an ever expanding footprint. I don't even know how many hospitals we comprise now, but we keep our residents. We have, like I said, we have the 2 clinical sites, one in Allentown, one in Bethlehem, and we really keep our residents to our 3 major hospital sites. Muhlenberg Hospital in Bethlehem, PA, where we have a clinical site, and it's a level 2 trauma facility. Our 17th Street site in Allentown, which is our ambulatory care facility. So we have a lot of our other ambulatory physicians' practices there. And Cedar Crest in Allentown, which is our level 1 trauma facility and where most of our inpatients are. Day to day, that's a little harder to say. Every day is a little bit different. We do practice a comprehensive care model. Our goal is to transition a resident from dental school to private practice as seamlessly as possible. So we want you to start treating patients the same way that you will treat them once you go out into private practice. We do the CODA mandated rotations, because we are a hospital residency and we do have to maintain our accreditation. So you will spend 2 weeks in medicine. We break those up as 1 week in emergency medicine and 1 week in family medicine. And you will do 2 weeks in anesthesia. The rest of your time, you will basically be in the dental facility in some way, shape, or form. Because we do have a little bit of a diverse area that we cover, when you are on call, which you will take call for a week at a time, because there are 8 residents, you basically take call for 1 week every other month. You will be on call for all 3 of those hospital facilities. At our Bethlehem facility, we have a behavioral health unit. So you will come in and you will see those patients. They don't want you on the unit. They want you in the dental clinic. So they'll bring the patients to you. So you'll come to the clinic and see those patients. But because you're very busy when you're on call, we are not scheduling you in the clinic with your own patients. You're really doing all these other things. You're also doing any OR cases that we have scheduled at that time, because we also take a lot of our special needs, not a lot of our special needs. We have a very robust population of special needs patients who require care under general anesthesia. So we do take those to the OR. We do have a pediatric dentist who takes some of our pediatric patients to the OR when they require that. And of course, you will be doing trauma call, so you'll be going into the OR also with the oral surgeons to do those cases. What else would you say about day-to-day, Dr. Boss?
Day to day, for the most part, you want to, like Dr. Pisano was saying, you want to run it like you would run your own type of practice there. We find a lot of it is sort of resident driven as well. There is opportunity for any type of procedure that you want. You know, we have enough attendings who have specialties and subspecialties in the different practices that you can learn anything that you want. As far as like Dr. Schrenker was saying, you have a population of people who always can't afford the treatment here. We do allow a certain dollar amount of what we consider teaching funds to help support that to be able to give the patient the best care. For example, if somebody truly can't do the endo because of a financial concern, in lieu of extracting the tooth, we will sort of see if we can help support them financially with doing that, just to be able to maintain the tooth. So.
And I should also say Lehigh Valley Health Network is a private, not-for-profit hospital. So not-for-profit is important to you as a potential resident, because it means that we are not a profit-driven organization. So our dental clinic alone loses several $1 million a year. And the network supports us because they're supporting care for the community. All of the patients who come through the dental clinic either get a 50% self-pay discount or an 80% discount if they apply for our financial assistance program. So very, very rarely do we find that finances are going to stand in the way of your educational opportunities. The patients that you see, very, very, very similar to what Dr. Schrenker said. You're going to see a lot of medically complex patients who have a harder time getting care on the outside. Obviously, we are there to support the community, so you're going to see a lot of disadvantaged patients and for whom you are really their only access to care. You will see a lot of medically compromised patients. We do clearances for orthopedics, radiation therapy, prior to radiation therapy or other immunosuppressive therapies, prior to for cardiology patients who are going to have valve replacements, and for transplant patients. And obviously you see all the trauma patients when you're on call. And general expectations, that's such a tough thing, right? Because I want people who are interested in learning, who are open to new ideas. But basically, this is what I literally wrote down: be on time, be prepared, be respectful, and have a great day, because it's always a good day at LVH Dental.
Right. Show up and push yourself. Be ready to learn, challenge yourself. You're there. It's a transition period between dental school and going out into another venture in still a learning facility where you're have the attendings there to help you along. Learn new skills, practice those skills, grow from what you have in dental school. And I think all the programs, that's one of the biggest goals, to help you develop and grow your skills and become a more qualified practitioner.
And we are also a 12-month program plus 2 weeks for orientation. So, right, but it's a year. It's a very busy year, just as Dr. Schrenker said. Very busy year, very fruitful year, and a year of tremendous growth. I mean, we see it every year when we see the people who come in and the people who graduate, and it's an amazing year.
Certainly is.
The end.
Yeah, I would add that not only is it a busy year and a growing year, it is challenging, and you're going to learn a lot about yourself too. And being a learning institution, what's really nice, and I'm sure Lehigh Valley's the same way, is our physicians, they're all tuned into the teaching process as well. So when our residents are on rotations, whether it be ENT or internal medicine or oncology, the attendings that they're working with there are very, very much tuned into, hey, this is a dentist and I have an opportunity to bring them up to speed on some things. And they really work hard at trying to tailor the experience for our residents to focus on what does a dentist need to know in treating these type of patients. And it's it's just a wonderful atmosphere. And it's an opportunity to do things, see things, and be involved in things that you may not ever get a chance to do again in your career. But at least you're going to be able to say, when you do cross that, it does cross your path, you're going to be able to say, oh yeah, I've been there. I've done that. I remember somebody explaining to me what I do in that situation. And you're miles ahead of the pack, so to speak, because you've already experienced some of these things that some people may or may not ever see in their careers, but you've seen it. You may have seen it multiple times. What's the unique advantage of coming to a GPR for a year, especially a hospital-based program.
Agreed.
Dr. Hassani, do you want to go next?
My turn. Okay. Can you guys hear me okay?
Yeah.
Hi, I'm Ran Hosseini. Actually, I'm the chair of the Department of Oral Maxillofacial Medicine, Pathology, and Surgery at Temple School of Dentistry. I recently got a new program director, so I'm not a program director technically, but I was there for a while. I actually want to give a big shout out to all the GPR colleagues. So I'm a product of a GPR. I went through a very clinically strong school, dental school, and of course, it's back in '91. And I actually felt quite, comfortable to do any kind of general dentistry. I could have essentially gone to private practice and have been fine. But then I decided to do a year of GPR. And from all my years of training, I have to admit that year was the most transformative. When I finished that 1 year of training, I realized that there's nothing I cannot do. Not saying that I didn't have the knowledge and skill to do everything, but I could figure my way out on everything. And I have to admit, I think to me that was very transformative. It completely changed my perspective of dentistry, my life, et cetera, et cetera. And admittedly, I got exposed to trauma and reconstruction, and I decided to pursue oral maxillofacial surgery. But ultimately, I think it was a great experience. And what I tell all my dental students at Temple and when I was in California before, that unless you're planning to join, well, I would say no matter what, even if you plan to join mom and dad's practice, I would say definitely do a year of GPR. You won't lose anything at all, and you will gain tremendous. So anyway, just my 2 cents on it. From someone who's not currently a GPR, you should definitely do one, regardless of all the state regulation, et cetera, et cetera, et cetera. You will come out of it a completely different person. So as far as oral maxillofacial surgery goes, for those of you guys who are interested, so OMAS is a little different because they all have different formats and such, but at Temple, we have one position per year. But again, different programs have anywhere as many as 4, and again, as little as 1. Our process is a little different because we're a dual degree program. So essentially our residents, what happens, we have an integrated program where they get the OMAS certificate and also an MD degree. So for us, the interview process is designed as such that both OMAS service and medical school admission team, interviews people. Every year we have somewhere around 70 or so applicants. From that 70, typically about 40 or so are qualified candidate. From that 40 or so, we typically pick about 15 to 20. And if the medical school agrees upon it, we typically interview about 10 to 12, candidates for our position. When to apply, our program deadline is October 15th. And as everyone said, you really have to get started early because there are a lot of preparation, recommendations, you're getting all your stuff together. And yes, definitely most of our students, sometime during their early to mid 3rd year, they start the whole process. As far as stipend, again, we are in OMS, things can be a little different. Sometimes, for example, single degree programs, you get paid you don't get your MD degree, but you're actually in an OMS program for 4 years, and you get salaried, as was discussed before, at different PGY level, PGY 1 through 4. In a dual degree program, such as us, we actually pay our residents through the whole 6 years, but not necessarily all programs do that. Meaning that during the time that you're medical school, we also pay you salary as well. But again, that's not necessarily universal across the board. As far as day-to-day activity, pretty much everything that everybody else said, the clinic, operating room, on call, our didactic curriculum, grand rounds. At Temple, we are fortunate because we are dental school based, and we actually have multidisciplinary grand rounds with our periodont, grad perio, ortho, endo, etc. So it's actually a very formative experience for all the residents to kind of get different perspective. And admittedly, most of the time, just like what was mentioned before, like the hospital-based GPRs, that's where I did my GPR. Most of the time, you're doing something within the hospital with medical colleagues. As far as patient, we see all of the above, for good or bad. Unfortunately, most of us who work in institution and hospital setting, unfortunately, patients have nowhere to go. And it's kind of sad that, many practitioners in the community, even though they're technically capable of doing things, they don't, just because of that fear of, I don't know, this patient has some kind of cardiac problem. What am I going to do? And that's the kind of fear that after med, once I did my GPR, it was just like, okay, I may not know it, but I can figure my way through it. And it was kind of very easy for me to manage that type of patient. So again, as was mentioned before, general expectations. I personally, we joke around that I have really two characteristics. One, someone who's teachable, meaning that someone who's actually interested to learn, want to be taught new things, want to experience different things. And someone who's a team player. We are working in a team environment. We are very close. Being on call, being in the clinic, being the OR, even after med, for my 1 year of GPR, I still form very close relationship with my co-resident. And, we after all these years, we're still kind of, see each other at meetings and stuff like that. So I think as a teamwork is the key. So I think, in my opinion, those two characteristics are probably most important. Program length, most of the oral maxillofacial surgery program, well, in the US, we have about 50% single degree, somewhere around 50% dual degree. Single degree programs are about 4 years, and dual degree programs are about typically about 6 years, they're integrated. What else am I missing? Anything, information that, well, I guess there's going to be a little bit of QA session and any information I can provide.
Yep, that is good. Dr. Palowitz, you are next.
Hi, my name's Dr. Beth Polowitz. So my program is dual run by both the University of Pittsburgh Dental School and UPMC Presbyterian Shadyside Hospital. I'm not going to reiterate what my colleagues have already said. We are a match program. We use a DIA pass for applications, almost identical deadlines and recommendations for getting your things together. We interview just a little bit later. We'll be into mid-November. We'll wrap everything up before the holidays. We have 3 positions. We have the same general. Now, I can't give you to the cent of what our PGY1 is. I feel a little inadequate for that, because in my mind I was thinking somewhere around $67,000. So that's about right. It goes up every year for cost of living. So, in general terms, but we are a GME program, which means that similar to every other PGY1 resident across the UPMC system, the dental residents have the same stipend and benefits package available to them. We are a 1-year program. We do take call. We work very closely with our oral maxillofacial surgery co-residents, the PGY1, the intern year for the OMS residents, and our GPR residents spend a very large amount of time together. We are in the process of changing the footprint of our program. Traditionally, when I did this residency a million years ago in 1993, we were housed wholly in Montefiore Hospital, and actually until this year that was still the same. But what we are doing is, because we have the benefit of being co-sponsored by the dental school, we are transitioning our program to having the restorative aspects of our program at the dental school and the hospital-based aspects of our program in the hospital. I do think that that is a better transition to keep up with technology, to keep up with opportunities for collaborative care with the other residency programs, the perio, the endo, the pros, pediatrics, which frankly we had no exposure to when we were a strictly hospital-based program. And I do think that preparing you for general practice, I think it's important for you to be able to understand how to work with kids. And the focus of our patient population, again, is exactly the same. You know, we work with Catholic Charities of Pittsburgh, similar to the AGH program. You have to have a heart for community service, whether that's actually out in the community or whether that's for treating the patient populations that do find ourselves in our clinics. We are the last resort for a lot of patients. And I do feel that once you are finished with a GPR, I hear it from what my colleagues are saying, you get a level of confidence that you can treat probably some of the most difficult to treat patients that your colleagues down the street, not saying that they don't have the skill for it, but they might not have the confidence for it. And that can make a difference for you in your practice. Being able to understand how to evaluate a patient's complex medical history and knowing that you can effectively make a good treatment plan and help that patient guide through treatment. It is very satisfying. You know, Dr. Hosseini said it, you know, we will get students that come in from dental school, maybe seeing 3 patients a day, and that's pretty typical of a fourth-year dental student. We'll try to transition you to get that confidence level to be able to see a full slate of patients. Now, we're not masochists. We're not going to throw you right into that from the beginning. You know, we're there to support you and guide you, but we also want students who are, or I'm sorry, we do want residents who are willing to stretch themselves, to understand that I don't need to come in and check your prep. Please run something past me, you know, say to me, hey, I was thinking that there are a couple of different treatment plans that we can go through with this patient. So we're there to help guide you. We're there to help you see that there's more than one way to solve a problem, start treating patients more independently on your own. We really want that to be your experience when you come out of the GPR. We also will do a lot of didactics. You know, we are CODA accredited, as every other program here is. So there are, you know, journal club, there are grand rounds, there are collaborative treatment plans that we will put together. You'll have an anesthesia rotation, a general medicine rotation, some trauma and oral surgery rotations. All of those things are universal to all of our programs. And those are some unique experiences that you will not get if you don't do a GPR program. I'm going to just say something here. When I did my residency program, one of my favorite rotations was the anesthesia rotation. And that wasn't because it's fun to intubate someone or learning how to start an IV or anything like that, but I was exposed to surgeries that I would have never seen if I hadn't been on that rotation through my GPR program. And if you like to learn and you like to experience new things and you're a curious person and you want to just be the best doctor that you can, you're really going to get some unique opportunities in a GPR program to do that. We do all of the medical clearances similar to everyone else for cardiac, transplant, oral cancer, just medical clearances for inpatients. We do all of that as well. We're a 1-year program. My expectations, as I think I've probably let it be known, I really want curious people. I want people who want to come in and learn something new today. I want people who are collaborative, like Dr. Hosseini said. It's a rough and tumble very busy one year. And if you don't have the ability to work well with your co-residents and the other residents in other departments, it can be pretty stressful. But if you are someone who likes to be collaborative, who likes to learn and isn't afraid to stretch themselves, then doing a GPR is definitely the right fit for you. I personally think that everyone should do a GPR. The state of Pennsylvania doesn't currently require it like our neighboring state, New York, does for licensure, but I could not be more of an advocate than I am for the benefit of a GPR. It is a perfect transition for students between dental school and private practice. I think it instills in you a love of learning and a love of collaboration. And you know, in dentistry, sometimes we do practice in our own silos if you're in private practice. It's nice to work with other people and to collaborate. And I think that you will learn that in a GPR.
Great.
So that's what I would have to say.
All right, we can hop into Q&A. I do have a few here in the chat. So let's see. Okay, it doesn't look like there's any specific questions in here, just some other things. If anyone has any questions, feel free to type them in the chat and I can read them out loud, or you can unmute and ask them yourself.
Hi there. I have a question. This is for anybody on the panel. So as far as 1-year post programs for dental school, there's GPRs, but there are also AEGDs. And I was wondering if you guys could speak on the main differences between the two and kind of why one would choose a GPR or an AGD, depending on what they want to do, kind of the advantages and disadvantages of those programs. Thank you.
Well, I can talk a little bit about that. I mean, so the University of Pittsburgh used to have both an AEGD and a GPR. Currently, we only have a GPR. For the most part, it's the hospital-based part of that program. Very few AEGDs have the same type of exposure to a hospital experience that a GPR will have. You can go ahead and look, if you go to the CODA website, it'll show you what the different expectations are for both an AEGD versus a GPR. Now, I will say this, you will get a good experience with any postdoc training that you get. I would say that if you want to be a restorative general dentist, an AEGD or a GPR are both good choices. If you want a little bit more hospital exposure, then a GPR would be a different choice for you. Whatever anybody else wants to add to that, please feel free. But that's my opinion on those two programs.
If I could make a comment about that as well. We do have an AEGD program at Temple, and I love them. They're great kids and great program. But I have to admit, GPR, at least in my opinion, is a completely different experience. Well, let me rephrase that. Both from CODA perspective, there are certain requirements in restorative dentistry and various dental stuff. But I have to admit, I mean, I think when I compare our GPR, when I was GPR and when I was a director of GPR in California, compared to what our AEGD residents do, in my opinion, is completely different ballgame in many levels. Certainly, the hospital component of it, certainly the exposure you get to the complexity of medical condition that we have, certainly the collaboration that you end up having with a lot of our medical colleagues, in my opinion, is an experience that you will never get in your life, unfortunately, and certainly is something that you will not get to AEGDs. But at the same time, you know, and I have to admit, when I look at our AEGD program, I don't necessarily see they're doing anything amazing that we don't do in GPRs. They're not doing 3 zillion implants or anything like that. But I guess the point is that I think GPR is going to be a completely different experience in many levels compared to AEGD.
Yeah, my thought on it is that someone coming out of a GPR program is going to be more conversant to be able to make referrals in a more timely fashion to the appropriate practitioners, whether it be, hey, I'm looking at something that I really don't know what I'm looking at. Is this something I need to send to my oral surgeon colleague, or is this something I should refer over to ENT? Or the patient comes in with a history and you say, you know what, I can pick up the phone and I can reach out to that physician's office and I can ask some questions and ask better questions about how should we work together to collaborate on the management of this particular patient's situation. The cardiologist might tell you, you know what, you want to take them off the anticoagulant, for example, but recognize that if I take them off the anticoagulant, their risk for having a stroke or some other bad reaction or something is greatly elevated. And I really don't feel comfortable doing that. And if you've been through a GPR and you've worked with the surgeons and you understand, how to manage patients post-operatively, then you're going to say, oh, okay, fine. I can deal with this patient without taking him off the anticoagulants. Or if you're not comfortable, you say, okay, I'm going to refer him to my oral surgery colleague. So if through a GPR, you're going to be exposed to all these different situations, and you're going to have a better understanding of the questions to ask, what you're looking for, and how to manage the situation so that you're better prepared to direct these patients to the right place in a more timely fashion so that they can receive the care that they need. Yeah, it's really what it boils down to. It's timeliness sometimes for the referrals as well. And again, if you don't go through a hospital-based program, a lot of this stuff, when it comes to lab values and the medications that you're taking and the interactions between all of these, you don't quite get the sense of that because you're not using it on a regular basis.
It's great. Thank you guys so much. I do have another question. How are the residents evaluated in these programs? Is it because they code accreditation? Are there like grades or anything, or is it like a competency exam type stuff?
So there are no number values like you have in dental school where you have to hit certain marks. I think that this is something that maybe Dr. Boss alluded to when he said it's very resident driven. So the experience you have is very much based on how directed you are in getting your patients through treatment. Obviously, we're not going to let you not do anything. That's never going to happen. But you do have to, if there are certain things you really want to experience. I always say, because we've all said, we're often the area of last resort for our patients. So like implants are a two-edged sword. If you want to restore an implant, you're going to need to place an implant. So you're going to place those implants with our surgical colleagues. But there are no numbers, but you are evaluated. You're evaluated, and you will get to see those evaluations, but there's no such thing as a grade or a number. I personally don't do any OSCEs. I don't know if anybody else does those. So it's a more collaborative and collegial environment, I think, than what you are experiencing in dental school. And the way you're experiencing it in dental school is appropriate for your pre-doctoral education.
We have what we call progressive responsibility. So, through GME, through graduate medical education, we use MedHub. And so what we have in there is we have, it feels like an exhaustive list, but every time I look at it, I think that there should be another procedure written on it. But so, you would come in and you would go through orientation and you would start and, we'd sort of get a feel for where you are. And, we have residents that come from different schools. And so different schools will have different focuses. People that come from the same school will have had different experiences in their clinic, different levels of comfort. But what we do is, with progressive responsibility, it means how much over the shoulder, how much, collaboration, how many things do we have to discuss before you do it? So, the farther you go into the program, the more freedom you will have, I guess is the way to say it. But it's not based on a letter grade. There aren't, practicums or things that you'll have to see. It's when you're working with attendings, they'll say, oh, well, you know, I have someone that's coming in from a dental school where they did 115 extractions, and I might have someone that comes in from a dental school who, you know, did the minimum that they needed to get their graduation credits. So, you know, those are different levels of experience, but we, you know, our goal is to get everybody as close to the same place as possible. It's just that everyone might get there at a different pace or a different rate. And so that's what we call it. We don't call it grades or evaluations, but what we do is we have a check-in at different points along, you know, along the 12 months. And the way that I do it is I have the residents self-evaluate first. You know, this is where I think that I am. And then we say, okay, well, this is how the attendings feel about that. And, you know, just get everybody to the same place. We have goals, we set mutual goals, and, you know, it's our responsibility as much as it is our residents' responsibility to meet those goals. So that's how the evaluations occur for us.
Yeah, we do a similar thing. Quarterly, I sit down individually with the residents and review what has happened in the last quarter. It's more of a seeking information, and then the faculty's assessment of their progress, areas where they're showing strength, or areas where they've shown that they really need to work on, whether it be their professionalism, whether it be their communication skills, and the words that they use in talking with the patients. And we try and pay attention to what's going on during the clinical time with the residents. And also, there are no grades. We basically are asking you to be self-motivated and self-starters when it comes to learning and pursuing things. And often one of the things that I like to do is a student will come, or a resident will come to me and say, oh, you know, what about this? And I say, you know what, that's a great question. And I don't have a really good answer. So you know what I'd like you to do? Go and research the literature and come back and present it to the rest of the group. And they're like, you want me to do that? I was like, certainly. You know, I don't know everything. I know a lot, but there's certain gaps in my knowledge too. So by showing the resident this, like, hey, I'm here to help you, but you can help me too. We can learn from one another. So yeah, we do evaluations. We ask the residents to evaluate the faculty as well and give us feedback at the end of the year on their experiences, so that we can evolve the program. And if we're deficient somewhere or we're weak somewhere, then we can make changes to the program so that it is a good experience for you. And every resident has different goals and goals for coming. And we try to talk with them and find out what it is they hope to accomplish by spending a year with us. And then we try to help them to achieve that. And what's interesting is often you'll find residents will come in with one set of goals in mind, and as the year goes on, it's like, In fact, I just had a talk with one of my residents today, and she was gung-ho to do perio. Now she's like, you know what? I don't think I really want to do that. I think my place is in general dentistry because of all the things you guys have exposed me to in the last 4 to 5 months. It's like there's so many pathways for me to pursue. And that's really the whole goal of attending one of these programs, is to find out where your niche is and where you want to go with this, because general practice it's wide open. And as long as you're performing at the same level as your specialists in your community, you're fine. If you're performing specialty procedures and you're not at the same level as the specialists in your community, you're operating in a gray area, and you're probably going to wind up living to regret that. But by coming to a GPR, you start to understand what your limitations are, where you need to strengthen yourself, what areas you need to focus on, and then you can really begin the true part of your professional education. And that's through doing it and working with people that know more than you do, and not being bashful to say, hey, I need a hand here. I can't do this myself. And you start to build a team. I tell my residents, look, to be able to perform dentistry at the level that we're capable of performing, and the wonderful technologies and procedures and everything that we have, you have to put together a really good team that you have really good relationships with. So you can pick up the phone and say to the surgeon, the periodontist, the endodontist, whatever, the orthodontist, hey, this is what I'm looking at. And then you can get together and you can share, you can talk, and you can talk to each other as professionals, not as I know more than you do, and you know, why are you bothering me with these stupid questions? It's just I can't tell you how much passion I have for the practice of dentistry, because there's just so many things out there for us to be able to do, and the way we can impact patients' lives and the good that you're capable of doing. Like I said earlier, you have a special set of skills that nobody else has, and you have things to offer that nobody else can offer. So by beginning in a residency program, whether you go to a specialty program or whether you come to a GPR to start your career, it's just the beginning. And I hope it's an exciting journey for you. It has been for me. And I graduated from dental school in 1978. I've been doing this for a long time, and I'm still not tired of it. Every day is an adventure.
Okay, I did have two questions in the chat from the same student. So I will read them together. The first is, does GPR have classes? And then also, do a good number of GPR residents also specialize after hospital exposure?
Great questions.
Yeah, I get that. I'll start with that if that's okay. So yes, in response to do we have classes, every Wednesday morning is a didactic day. We actually do it in conjunction with another hospital group of residents to get you better exposure to more varied lectures. So every Wednesday you will have lecture, and then you'll see patients in the afternoon. As far as specializing, we have some who decide that during the course of their residency, they really enjoy one particular specialty and then apply to it. But the vast majority of them are general dentists.
Yeah, I would say maybe 20% at best, right? Decide to specialize.
I think that's probably about what my experience has been with my residents. I've also had residents who have been in private practice for a couple of years after doing the GPR that have then decided to, for instance, I had a resident from 3 or 4 years ago that is in an endo residency right now. He decided after practicing for a few years that he then wanted to, go into endo. So, I think probably the number one specialty after GPR, as Dr. Hassani would attest to, is OMS, especially because of the exposure, to the hospital setting. But, the vast majority will go into private general practice dentistry. And we do have didactics, we have journal club and other, what we would call non-clinical time in the program.
Likewise, we have lectures from faculty members who are basically teaching. That's how I got connected. I would come in 6 to 8 times a year to lecture on general dental topics to the residents. Did that for quite a while before I joined the program. We have specialists that do the same thing. So we have lectures in perio, endo. We have a lab tech comes in and talks on lab topics. So we have a lot of 1-hour lectures for our residents. We don't do any, we have the other things required: journal club, treatment planning sessions. We also attend pathology lectures with the oral surgeons. We also have treatment planning sessions with the oral surgeons. And so there's a lot of lectures that go on, usually I would say on average 2 to 3 a week, whether it's with faculty or whether it's with the teaching faculty that will lecture. So there's a lot of opportunities to hear on topics in the specialty areas, as well as how it relates to general dentistry. And with all the things that are available online, if you want to seek things out, there's all kinds of other things. One of the things that I do offer to my residents is that I've been a member of a Seattle Study Club group here in Pittsburgh for many, many years. And we're blessed to have 3 different Seattle Study Clubs here in the Pittsburgh region. And each year, our study club directors offer the residents at AGH the opportunity to attend these meetings and they get a chance to then meet other practicing dentists in the community, as well as hear top flight speakers. So we also emphasize continuing education for our residents as well. So you can be as busy as you want to be, or it's like anything else. It's what you get out of it, what you put into it.
Okay, are there any other questions? You can type or unmute.
Hi, I'm back. I have another question. So for the ADEA pass/match program, is there a couples match? I know that there is for medical school for significant others who are in the same graduating class. But does that apply to dental as well?
Yes, yes, it does. Not last year, 2 years ago, we actually had we had 4 residents, all of whom had come through the couples match. And no one is aware of that on the other side, just so you know. You apply and you interview, and you don't have to disclose that. As a matter of fact, I didn't realize that any of them were applying as a couples match until after match.
Yeah. We had that experience one time, and unfortunately, the couple, due to some family changes, had to decline their opportunity to join us, but we don't have any issue with that.
Yeah, I think that if you participate in the match like we do, that's something like Dr. Pisano said that happens behind the scenes. It doesn't necessarily have to be disclosed, but that's similar to the medical match. There's the couples match.
Okay, thank you. And then my final question, I promise. So as far as seeing patients, what's the ratio of like your own like routine care patients, and then for GPR, you're seeing these medically compromised complex cases, and you're collaborating with all these other departments and other physicians. So kind of what's the breakdown of that? Like how much of it is like your routine general practice stuff, and then how much is the hospital based?
So they're all hospital-based patients because they're coming to us from our medical colleagues. So in general, you're seeing the more medically complex cases. But as far as patients that you're going to see that come through the ED as an emergency type patient, or patients that you're going to see for clearances, you probably I would see like 1 a day that is that, and the rest of your appointments would all be your comprehensive care patients.
I would say 2/3 to 1/3. I think in general terms, 2/3 routine, restorative, and 1/3, hospital-based medically complex. But it could be a day where there's 6, and it could be 5 days where there's 0. I mean, it just, we take all comers, so it just depends on how things go. And the day that it's 6, it feels like it's 20, and the day that you have 5 days in a row that there's none, you feel like you're getting bored. So that's just life. You take it as it comes.
Yeah, exactly. We take the patients as they're scheduled and deal with their issues. And again, often you'll see people who are really sick because we're their last resort. But then you'll see patients who have no issues whatsoever, but they can be challenging in other ways. They might be management problems, or they might be an anxious patient. So again, we see patients, the full spectrum, whatever you can imagine. You'll probably see a patient like that at least at one point during your residency. And that's, again, you'll see patients that are going to take up a lot of time and effort just to get them to understand the nature of their dental problems and how you can help them. And they'll drain you just to get them to a level of understanding. Then you have other people that are medically compromised and very complex, and they're very easy to get along with. They say, yeah, okay, fine, I get it, I understand, I would like to proceed with treatment. You never know. And that's the value of spending time in a program like this. You're seeing a true cross section of the population, and you're going to learn a lot of valuable skills in people management. So,
Okay, thank you guys, and thanks so much for being here today.
I do have another question in the chat. How can dental students prepare best for GPR and OMS residencies? And she is a second year.
Well, if I could start by commenting, I always tell at least all our students, just be a good student. You know, I mean, I don't know how to define that, but I think if, from my perspective, gaining all the information you can, get involved in all your patient. In OMS, some people say, "Oh, I hate doing dentures, so I'm just gonna focus on oral surgery stuff in the school." And I'm going, actually, that's a terrible idea, because in OMS residency, you're going to be doing, going on different rotations. So if you cannot guide your learning experiences and enjoy and learn from every experience, then I think you're wasting your time. So anyway, so I guess the gist of it is that if I have to say anything, I would say just be a good student, do your thing, take care of your patients, learn as much as you can from everyone. Hey, just be organized in terms of you preparing for your application and stuff like that. And I don't think you can go wrong with that.
Right, I agree. Just be prepared to, like you are now, to graduate your program. You know what you're learning and what you're doing to prepare to finish that program. And then when you get to a residency program, be prepared to do more and challenge yourself even further.
yeah, I would agree. Being a good student, showing an interest in what you're learning, asking lots of good questions of your professors and the teaching faculty at your school. If you find a topic that's of interest, go look it up. Do a literature research and learn more about it. And definitely take advantage of every possible opportunity you have to do something with the faculty. If there's something going on, just stick your nose in there and find out what's happening, and ask questions and show an interest in what people are doing, and ask questions. Why are you doing that? Okay, how's the best way to do this? And just be engaged, and just look for opportunities to participate, because every little thing that you learn, you can then use later. I use the analogy of, when you start in your career, you have a toolbox and it's empty. Well, now you're starting to learn the skills and acquire the knowledge that you need to put into that toolbox, so that when you do go into practice, you have what you need to do what you need to do for that particular patient. And I know that a lot of students will say, well, we don't have the opportunity to do this or that, or there's not enough patients to go around. I said, well, okay, then it's up to you to put forth the effort to find opportunities. Maybe even help one of your classmates be a dental assistant one day when they're doing an endo, so you can see how it's done, or spend time down in the surgery clinic and to see how the surgery residents are doing things. It's whatever you can do to gain insight, gain knowledge. It's going to pay dividends later on.
I would say that, if you're lucky enough to go to dental school where none of your patients ever cancel or don't show up, then you won't have the time to do this. But I mean, I know my experience was that sometimes patients don't show up for their care that day. So, if you want to prepare yourself to be a good resident, then you can either go down to the emergency clinic, or, go to the screening clinic, or just go to a place where they need help, and make yourself available to help. That's excellent training for any of our programs, because you've heard all of us say that being a collaborative resident is something that's very important. So just practicing that skill of, instead of going back to your apartment early because your afternoon patient canceled, go and spend some time in one of the other places in the dental school where you'll have an opportunity to learn something and to be of service to your classmates or the other clinics.
Okay, any other questions?
Yes, I have a question. My name is Holly, and I'm out of Louisville, Kentucky, and our GPR program had an Instagram where students could kind of keep up with the cases that they're doing. Do you all have any platforms like that where we could kind of see different things that you're doing?
That's a tough thing, HIPAA wise, to
Yeah.
have a platform where you're showing your
Yes.
cases.
Yeah, they
that
mostly
would
have
not
that.
fly. I mean, LVHN would have a heart attack if I did that. So I don't.
Yeah, we would not be able to do that from HIPAA either. That would not work.
No, we're the same, Holly. We're bound by HIPAA, and that would be frowned upon.
I figured. I just thought I would check so I could kind of see what y'all were doing.
Well, I know you're Louisville and that's hard, but if you were ever in Pennsylvania, I'm sure all of us would welcome you to come and visit the clinics and see what the residents are up to.
Yeah,
Certainly.
that's also my second question. CODA has been preventing applicants from touring the facilities. Is there a way that we can kind of get an idea of how everything looks and how the clinic runs?
Really, I've not heard that.
Yeah.
We welcome you to come and visit. You just have to, again, I think Dr. Boss put the lvhn.org in the chat. You'll find contact information there for our program coordinator, and we just ask you to call her and set up a time with her so that we know that you're coming in, because we don't want to have people that we're not aware of coming
Sure.
through. But yeah, we'd be happy to have you come through the clinics if you're coming up to Pennsylvania for the holidays or anything like that.
Okay,
Yeah,
thank you.
I believe there's a video tour of both sites on there as well.
I don't know
Okay.
if that's there, if I just mail that to the applicants that we invite for interviews. I don't think it's on our website, but I could send it to you, Holly. If you send me your contact information, I'll send it to you.
I will. Thank you.
Okay.
Yeah, I'm not clear on exactly what CODA's guidelines are. I know that our GME department it requires us to stick with whatever our accrediting organization guidelines are. And of course, during COVID, we were not permitted to have on-site interviews, and they've continued that. We're still not permitted to have on-site interviews, which is a great disappointment for us. But there's reasons why that makes sense. As far as visiting, if you as an individual decide to visit, as Dr. Pisano said, is, make an appointment, let us know you're coming. We can't not let you come, but on the other hand, we're not supposed to encourage people either, based on my reading of the regulations. I may be wrong, but there is, they feel that having contact with applicants before the interviews are done gives that applicant a potentially advantage over those who couldn't make the trip. So I'm not sure.
You're not supposed to weigh that either,
Right,
to
exactly.
advantage or disadvantage, but they can still come.
Yeah,
Okay.
that's the wording, that it's not considered an interview. The interaction can't be weighed,
Yeah.
Wait, okay.
in the decision making.
No.
Most of the people that I have come, historically that have come, are coming at the beginning, something like sort of between second and third year of dental school, just basically to see, is a GPR something, what they're doing. I think that CODA is trying to discourage having to discourage you from feeling that you have to visit all of the places that
Right.
you're applying to or interviewing. Visit should be sort of like, is this process right for me, as opposed to feeling like you have to go as part of your interview.
Yeah. Well, we welcome people to come and check us out, check out the facilities. One thing that we do is we make our current residents or past residents available for you to talk with. And it's totally, we ask the residents, number one, would you be willing to talk to to applicants and potential residents about your year's experience here? And if they agree to, then we make that contact information available to applicants, and then they can go ahead and talk to our residents, and they'll give you the truth. They'll tell you what actually their experience was. And some of them have really good experiences, and I'll be honest with you, some of them don't have they don't have a good experience for whatever reason. So, realistically, some people love the atmosphere. They thrive coming through the program, and others are like, I don't know. It's not so sure this was for me. But
honestly, Holly, no one knows what it's like to be a resident in that program as much as a resident in that program. So they're your best source of information, truly better than any of us, I think.
I agree.
Well, thank you all. I appreciate it.
Thanks for your interest.
Any other questions? Okay, with that, I will move on to our Connections mentoring program that PDA offers. You can get matched with a mentor based on criteria like location, practice type, and specialty. So if you would like to request a mentor, you can do so at the link on the screen. And if you need any help, you can send me an email as well. That is my email on the screen, so feel free to do either. And then if there's no additional questions, I want to say thank you to everyone for attending, and thank you to our panelists tonight for being here and sharing so much information about their programs and answering all of your questions. And there will be a post-event email with a survey. You will receive an Amazon gift card for filling out the survey, so keep eye for that. And then, sorry, I got a message. And then, is there any additional questions? Alrighty, well, thank you again, everyone, for being here tonight. And then I do have something here on the screen. PDA members can get exclusive values that aren't available to non-members on secure, high-quality products and services through the PDA Member Advantage program. This includes deals on credit card processing, dental supplies, student loan refinancing, website design, and more. To view a complete list of the Member Advantage partners, visit the web address shown on your screen. And then someone asked me to go back to the mentor link, so I will do that. And then, yeah, if there are no other questions, everyone have a wonderful night, and thank you again for joining.
Thanks for the opportunity.
All right.
Really
Thanks,
appreciate
everyone.
it.
Thank you,
Good luck,
Yeah.
everyone. Good luck on your boards.
Oh yeah, big week this week.
yes. Stay well and enjoy the holidays.
Bye-bye.
Thank you all for attending. And Amanda, thank you for hosting.
Of course. Have a good night, everyone.